Hello, you're welcome to my platform. I am Dr. Sandra Nabukalu and I am a surgeon. I help you become aware and sensitized about the different surgical conditions. Today's video is about venous ulcers. By definition, venous ulcers are chronic superficial ulcers that occur in patients with chronic venous insufficiency. By the way, chronic venous insufficiency is a condition that is characterized by inability of your veins to take back blood to the heart. By the way, just a side note, your heart pumps out blood to the body, and this blood is usually containing oxygen and nutrients. This blood is taken up by the arteries and the arterioles. The arteries are a little bit bigger in size and the arterioles are a little smaller compared to the arteries. The arterioles take this blood to the different tissues via the capillaries. The capillaries are the smallest in size. And these capillaries are usually within the target organs, the organs that are supposed to be supplied by these arteries and arterioles. So when blood reaches into the capillaries, there is usually an exchange of substances between the blood and the tissue that is being supplied. For example, the blood gives up its oxygen and the nutrients to the tissues, to the cells, and the tissues and the cells also give carbon dioxide and also the waste products that have been produced during their activities. So they give them up into the blood. Now this blood is supposed to be taken back to the heart via the veins, via the small veins as well. They are also called venules, and also the bigger venules called the veins. It's supposed to be taken to the heart via the veins. However, in the setting of chronic venous insufficiency, this is not possible because there are some abnormalities within the veins. For example, the valves. Valves are like some kind of tissue flaps within the inner lining of the veins. They are supposed to prevent blood from backflowing. However, in the setting of chronic venous insufficiency, these valves have a problem. So when blood is being taken to the heart, it backflows. It goes back to where it came from. And so the amount of blood that is supposed to be taken back to the heart is reduced in amount, in volume. So that is what really happens. When you have chronic venous insufficiency, you're going to suffer from some complications. For example, you're going to have a reduced rate of flow of blood. Because remember, blood is supposed to move freely, but now it is not going, so it backflows. And when it backflows, there is a reduction in the rate of flow of the incoming blood, the one that is coming from the heart. And so when that happens, you tend to have a reduction in the amount of blood and oxygen that is delivered to those tissues, because blood is coming but it is not going out of those tissues. It is almost as though you're pouring water into an already filled jerry can or an already filled glass. So that is the picture of what is actually going on. So those tissues are going to be in need of fresh blood, but this blood is not able to be brought into these tissues because there is already blood that is backflowing. So when that happens, the tissues are going to be deprived of fresh blood that is containing oxygen and also nutrients. So the cells are going to die off, get eroded, and then you form an ulcer. The other thing that can happen is there's going to be a reduction still of the nutrients that are supposed to actually take over the recovery of these cells that have been injured because of a reduction in oxygen supply. These nutrients include vitamins, amino acids, fatty acids, minerals. So those cells are still going to be deprived of those nutrients. and so recovery and repair of those cells is not going to be possible. So the cells are just going to die off without any chance of recovery. The inherent nature of the venous ulcers is that they are usually common in the lower inner one-third of the leg. They can also occur, but rarely, in the upper limb, for example, the forearm and the arm. They are usually common in patients that inherently have venous disorders. For example, they've had history of deep vein thrombosis, where you have a clot in the deep veins of your body, or this patient actually has varicose veins. The ulcer usually starts as a small ulcer, but it becomes enlarged. The floor will have some dead tissues, sometimes pus, which is very foul smelling. The edge of the ulcer will also be swollen, and there will also be some pain coming out of the ulcer. Speaking of this pain, the pain is throbbing in nature. It's as though you have a heartbeat in that ulcer. And this pain is usually relieved when the patient elevates their leg, or when they leave the leg open, so that the leg becomes cold. But this pain is worse when the patient lowers down their leg, or when they cover their leg. So that is how the pain manifests itself. The outline of the ulcer is usually oval in shape, and the surrounding skin is also going to be hyperpigmented or brown stained. This can easily be appreciated in light-skinned people. The surrounding skin is also going to be hardened. When you touch it, it will be very hard. The same thing happens to where the ulcer sits. The base of the ulcer will also be hard. The entire leg which has been affected will also be swollen, sometimes reddened, especially around the ankle region. It will also be reddened. The skin of that leg will be thin, and especially the distal or the lower one third will be thinner than the upper aspects of the leg, what we call the champagne bottle sign. And it is usually because that even the lower part of the inner part of the skin, which we also call the dermis, and also the fats are also affected. And so that area is going to look smaller. The lower one third of the leg will look smaller compared to the upper two thirds of the leg. There will also be some itching coming out of the ulcer. The ulcer usually takes long to heal. It can take like 6 months if you've had very good treatment for it. It also has a possibility of recurrency. And the sinister part of these ulcers is that they tend to transition into squamous cell carcinoma, especially the scar that has been formed has the possibility of transitioning into a cancer. That is the nightmare that comes with venous ulcers. The people that are susceptible to developing venous ulcers include patients that have had history of deep vein thrombosis, that is formation of a clot within the deep veins of your body. Patients with varicose veins, old patients, pregnant women, people that are on birth control pills, smokers, alcoholics, patients that cannot walk for some reason, patients that have had injury to their legs or have had surgeries to their legs for some reason, patients that are overweight or obese patients. All those are prone to getting venous ulcers. The diagnosis is essentially clinical. We usually do history taking and clinical examination. During history taking, we ask you some questions. We ask you if you've had any history of deep vein thrombosis, if your doctors have told you that you had a clot within your veins in the past, or if you had history of varicose veins, swelling of the veins of your legs, and also if you've had history of an ulcer, because if you've had history of an ulcer, there's a possibility of you having this ulcer again. And also if you've had injury to your legs, or if you've had surgery to your legs. During clinical examination, we always look out for any signs of varicose veins. That is, we make you stand and we look at your entire lower limb, looking out for swelling of the veins. We also look out for any associated signs. For example, swelling of the lower limb, that is swelling of the leg, any hyperpigmentation of the leg, especially the skin of the leg. We also look out for hardening of the leg. We also have to rule out a possibility of arterial disorders. This can be achieved by feeling for your arteries in the leg, because sometimes you can have an ulcer and it is actually due to an arterial disorder. So we must do that. We also do a test we call ankle brachial index. This is a test that compares the blood pressure in your leg and that of your arm to make sure that they are the same. They should be the same. But when you have an arterial disorder, the blood pressure in the legs are usually lower than that of the arm. And when we do that ankle brachial index and it is usually less than 0.8, we just conclude that you have an arterial disorder other than a venous problem. It is usually very important that we rule out a possibility of arterial disorders, because the management of arterial disorders and venous disorders is different. For example, we do compression therapy for venous disorders, but it is contraindicated for arterial disorders. That is why we have to rule out a possibility of arterial disorders. Investigations include a discharge study, where we carry out couch and sensitivity on the discharge. We do ZN, looking out for signs of TB, tuberculosis. Also do a cytology, looking out for any signs of cancer within your ulcer. We also do a biopsy, where we take off a tissue from the edge of your ulcer to look out for any signs of malignancy, any signs of cancer within the ulcer. We also do a venous Doppler, looking out for any obstruction in the flow of blood within the veins of your body, especially the veins of the leg. The management of the venous ulcers entails surgical debridement, where we cut away all the dead tissues from the ulcer. And we also do ulcer dressing. We also employ compression therapy. Compression therapy will help us take blood back to the heart. We also recommend that you elevate your legs above your hips. This can be done using pillows. Put them under your legs, under your feet, such that they're a little bit above your hips. We also give you painkillers, antibiotics tailored by the couch and sensitivity results. And if there is any itching going on, we always employ corticosteroid creams. The most important bit about management is that we always manage the underlying cause. If there is any varicose veins going on, we always do management of the varicose veins. If there is any DVT, deep vein thrombosis going on, we also do management of the deep vein thrombosis. When it comes to the prevention, we always recommend that please treat the underlying cause on time. If you have any varicose veins, please always seek medical and surgical intervention on time. Please avoid sitting and standing for a long time. Always elevate your legs at least 30 minutes a day, 3 to 4 times in a day. We always recommend that you avoid smoking, avoid alcohol. And when you have any surgeries, please ambulate or walk as early as possible. We also recommend that you use compression stockings, especially if you've had any history of a venous ulcer in the past. Yes, that is what I had for you. Thank you so much for listening to me. Please share my videos and also subscribe. See you in my next video. Bye.